Welcome to From Caving In to Crushing It, the podcast for those who find themselves immersed in adversity and choose to write their story instead of having others write it for them. I'm Drew Durrani, and I'm your host. Kristen, good morning. It's so good to see you.
Morning, Drew. It's good to see you too.
So Kristen, I am a flexible person, and I love that we're doing this on a Sunday morning. It's my first one on a Sunday morning, but you are so busy with your patients during the week, and I admire that. And when you asked about doing it on a weekend, I'm like, sure, absolutely. So this is my pleasure to be able to see you on a Sunday morning. Kristen, I always thank the individual who introduced me to my guest, and I need to thank Sajad Hussein. Sajad, thanks for introducing me to Kristen. There's always a reason why these introductions happen, and you all will find out why it was important for Kristen and me to meet today. So, why is Kristen on this show? So, I talk often about, and my audience knows this, I talk about how initially we're taught that life is linear. And it's not a malicious teaching by the people teaching us that. They want that for us. And we're told if you do A plus B plus C, D is going to happen. And for the most part, life is linear in the beginning, and then it's not. Something comes from the external circumstances will appear and get in between one of those letters. And that straight path in life starts to be a little more circuitous. And when that happens, sometimes we see adversity and do something about it. And sometimes we see adversity and don't. And sometimes we don't see adversity at all. That's why I believe there's three different people out there, three different men, three different types of women. For this case, Kristen, there's three different types of women out there. There's woman number one who's got so many blind spots. She's just doing what other people tell her to do, living other people's lives. She doesn't see adversity or even think she could change it, so nothing changes. And then there's woman number two. Woman number two has a heightened self awareness, especially from woman number one, and she sees that adversity. Yet, she believes that adversity is a barrier. She's the victim. Everybody else is to blame. Life is doing it to her, and there's nothing she can do. And on her deathbed, she has so many regrets. And then there's woman number three, the women I have on this show. Kristen's woman number three. Woman number three has a very heightened self awareness. She sees that adversity, and she's at the point in her life where she says, I'm sick and tired of being sick and tired. This adversity is not a barrier, this is an opportunity. This is life doing this for me. And I'm going to seize this moment to take massive action and do something different and become a stronger woman on the other side. So, Kristen, for the audience, please reach back as far as you need to for that defining moment or defining moments, either that tap on the shoulder, the whisper in the ear, or like what I needed, 2x4 upside my head, that transformed your thinking and your behavior from whatever woman you were to woman number three, the Kristen we're speaking with right now.
Well, Drew, thanks for having me. I appreciate the opportunity. It's a beautiful day here in Pennsylvania on a Sunday, and yeah, it's really great. So thank you for that. Thank you for doing what you do as well. I would say that the defining moment for me didn't come until I was about 40. I think whenever you describe woman A and woman B, I also went through some of those stages to become woman C because I think woman B happened during COVID.
Mm.
And I think everybody, not everybody, because I can only speak for myself, right? But I think during COVID, we felt like we were trapped and sheltered and that the world was against us. And I won't go deep into why those beliefs are there. We don't have time for that. But I think a lot of what happened during COVID was really transformational for a lot of people because during that, I felt like I didn't have control of my life, that the decisions I was making weren't my own. And throughout that, there's one day that just kind of a light went off. It's like, no, I have the tools and the resources that have been there all along. I just needed to reach deep within myself and believe in myself and use the tools that I've had. And that was transformational. Then, when I was 40, there was a coworker that came to me and she said, Kristen, I think the way that you interact with people and your thinking is a little bit different from others. And I said, I think I agree with you. So I explored that a little bit and found out that I have neurodivergent traits as well. And really through that became Woman C through both COVID and that kind of whisper in the ear that you spoke to. And understanding that sometimes people come into your life and you need to take their advice selectively and really trusting your gut. That's the biggest thing that I was always reluctant to do when I was younger is trust your gut instincts and learn to listen to people to a certain extent. But I think whenever you're making a decision, especially whenever you're a parent or whenever you have your own business, you know what's right. But sometimes there's that barrier that comes along that somehow it gets overridden. The good decision gets overridden, and then things start falling apart. So, really, now in my life, because of COVID and because of that person that I was working with, that I've really just trust my instincts, trust my gut, and realize that I'm enough, that I'm deserving, and that when you go through adversity, it's for a reason. When you go through hard times, it's a reason. And seeing that as what lesson did I learn when I went through that hard thing? What lesson did I learn and who did I become because of it? And really understanding who you are inside can be really transformational.
Because there's so much here. I'd like to go. I mean, I want to go back to when you finally felt like you could trust your instincts. And many of us, we know what we really think we should do or want to do. It's that self-trust.
Mhm.
When self-trust is lacking, that's when other people's opinions override your own. And the strength you found in yourself by realizing that you always had it in you. Um, what do you think made you finally feel that way? And
Mm.
what do you think caused you not to trust yourself and had you break down that barrier? Because many of us have those barriers.
Well, I think to answer your first question, what caused me to trust myself?
Hmm.
Partially when my son was born in 2017. And so he was born premature and spent about 2 months in the NICU. And there was a certain point after he was born, it was a week and a half, 2 weeks into the NICU, and the nurses weren't following his feeding protocol, and he wasn't making enough progress. And I thought to myself, I need to take charge here. This is my son. And so I think that motherly instinct kicked
Hmm.
in was like, I really need to have a talk with the head nurse. I'm going to have his feeding schedule posted. And I think a lot of that was transformational for me.
Hmm.
The thing that was holding me back, to answer the second part of your question, is whenever you're young, you're naive. It comes naturally. And you don't listen to the people that love you and are giving you sound advice sometimes. It's not always the best for you.
Hmm.
But one of the things that you're taught, depending on what household you grow up in, right? Because the way that you were parented is the way you parent.
Right.
A lot of that is paralleled, right? So you want to trust people that are experts in your life,
Hmm.
and you want to trust people that are, saying they're going to help you.
Hmm.
And sometimes that doesn't work out. If it doesn't resonate with you, I do a lot of work in the holistic space. And so for the longest time, I made decisions that went against that. And so that was the defining moment, I think, when my son was born and went through that experience in the NICU that was really transformative.
I love that story because it hits on number one, doing things scared, right? If you overthought about speaking to the head nurse, that those voices in your head would have stopped you from advocating for your son, right? That advocating for your son empowered you. That was an empowering decision. And once you completed that, and I'm assuming they posted the feeding schedule and things improved
They
and you
posted the feeding
progressed.
schedule,
Mhm.
and one of the nurses was using too much chin and cheek support to
Okay.
help with his feeding because he had some trauma, obviously being born premature.
Right.
But they were giving him too much chin and cheek support. So he had an abrasion on his chin because they were
Okay.
using too much. And so
Okay.
it was false hope because I thought that he was drinking
Okay.
enough weight to come home. Well, it was because he wasn't progressing naturally. They were using too much chin and cheek support. So that means that they're
Okay.
pushing the chin up and stimulating the cheeks for that suck reflex.
Okay.
So a baby will eat because he had a rooting reflex
Okay.
that wasn't fully developed. He had a submucosal cleft palate, meaning that the bony part of the roof of his mouth wasn't totally closed shut.
Mm-hmm.
It was just the skin on the roof of his mouth. So he was having trouble with a natural suck, swallow, breathe.
I see.
And so it gave me false hope, and that was crushing. And
So you're saying
that was
the too much of that pressure wasn't allowing him to naturally learn how to suck, right? They
right,
were kind of giving him
forcing it.
crumbs.
They were forcing it.
They were
Yeah,
forcing. Okay, so I understand. So that's very astute on your part to notice that. And so they changed that.
they did. That nurse never fed my son again.
Okay, beautiful. So then your son progressed. So that's definitely the empowering piece is actually breaking the cycle and asking for help. And
Oh,
then
right.
the thing that built the confidence was that, I mean, that result was beautiful. So you could take that feeling of being an empowered, mother and person and take that into other aspects of your life. And it seems like you've done that.
Right. And well, as a result of that, we got occupational therapy while he was in the NICU
Good.
so that I could learn how to naturally help him with that suck, swallow, breathe reflex
Mm-hmm.
so that he could naturally gain weight and drink and come home sooner. So, yeah, a lot of good things came from that.
Yeah,
And it's just,
that's a lot something that a lot of people don't know, the difference between physical therapy, speech therapy, and occupational therapy. Describe occupational therapy and maybe why some parents who are first-time parents may not think to suggest occupational therapy. You would think the healthcare field would offer that immediately. So
well, right.
tell
So,
the audience what
occupational
occupational.
therapy, there's different avenues of occupational therapy. So, I work primarily in early intervention and I see clients privately. But in early intervention, there's occupational therapists that work on feeding therapies.
Mhm.
So they will help children with the suck, swallow, breathe reflex. We had occupational therapy when my son came home. So they told me about feeding positions to help him so that he could naturally develop that suck, swallow, breathe without gasping for air.
Mhm.
And then he got gassy and all these other things. So it helped with natural comfort and feeding
Mhm.
and it really helped me understand his rhythms. So there's the feeding therapy part of occupational therapy. There's also the fine motor skills and gross motor skills part of physical therapy, where they will help with like hand putty and different hand strengths and crawling and doing all of these motor movements to help with development. Then there's the sensory part of occupational therapy. So you can do sensory bends to help desensitize children to certain textures, but then there's the deepest level of occupational therapy. And when I had a clinic, the occupational therapist that I work with, Mandy Keckler, she is amazing. She actually was interested in more of the holistic method after she took one of my trainings. And
Mhm.
so we connected and had the clinic together. And she specialized in something called primitive reflex integration. And so through the primitive reflex integration, children can really work through trauma on a physical level because when kids have any trauma, now it doesn't have to be like classic abandonment or physical or verbal abuse, any of those things.
Okay.
Trauma can be if you're born overweight or underweight, or if you're born via C-section, or it's traumatic for your mother during pregnancy, even in utero, or if you're in a car accident, you fall and hit your head. There's a lot of different things,
Mhm.
chronic
Right.
inflammation,
Yeah.
a lot of different things that cause trauma to the body. And whenever there's trauma in the body, it causes the primitive brain to be overly active, so the child is in fight or flight. And so, what you have to do, the whole goal of this is to understand what reflexes are still either retained
Hmm.
meaning they're overly active when they shouldn't be, or they're absent. They never developed in the first
Right.
place.
Right.
So really their goal is to assess the body and the movements.
Hmm.
They are unconditioned motor responses. So not unconditioned, but you don't have to think about them when they
Right.
happen.
Right.
So that version of occupational therapy really understands at the root cause what reflexes are there and what exercises we need to do to integrate them. So it's like an on-off switch. So I can use those reflexes when I need, but I can shut them off when I don't.
Hmm.
So when that happens, it takes the body from fight or flight to rest and digest.
Okay. I love what you're saying because this obviously there's occupational therapy for adults too, and
Oh,
most of that
yes.
is adults have already been doing certain things, then some kind of traumatic experience happens, and we have to relearn what we used to know. I've seen that in so many instances where we take for granted some of the things that are automatic, you
Mhm.
know? And then when God forbid something does happen, we got to relearn some things. So I always have a special spot in my heart for occupational therapists because I've witnessed it myself when I worked in healthcare. So thank you for explaining that. And so now let's talk about your son and how is he doing now?
He's doing really well. We didn't think that he would be able to talk or articulate well, I guess, because of the submucosal cleft palate.
Right.
We had genetics. We work with a craniofacial team at Children's Hospital here in Pittsburgh. And so we introduced, because you're uncertain as a parent, right? When you have a child, you have certain expectations about how they're going to grow up, right? A, B,
Right.
C, D, right?
Mm-hmm.
We build our own A, B, C, D for our own children. And so whenever they don't follow that developmental pathway, it's very hard,
Hmm.
right? So the things that I implemented, thank goodness I was working at the time on multidisciplinary teams. So I was working with amazing OTs and PTs and vision therapists and all of these wonderful people who really taught me about thinking outside the box. So we introduced sign language at an early age
Hmm.
and was fortunate enough to learn about developmental pediatricians and developmental optometrists.
Okay.
Really have been able to understand gut health and root cause analysis.
Hmm.
That was really the defining moment where because my undergraduate degree, my bachelor's is in human development family studies.
Okay.
So here comes a little bit of duality if we have time.
Yeah, absolutely we have
So
time.
the bachelor's degree is in human development and family studies. So it talks to you about lifespan development from birth to death.
Hmm.
What happens biologically inside the body, what happens socially. Then my master's degree was in applied behavior analysis.
Okay.
So it's understanding of behavior, what functions of behavior, and how can we look at changing it with positive reinforcement and good strategies, et cetera, and addressing skill deficits.
Hmm.
So it created a little bit of a duality because during my program, my master's program, they don't talk to you about the inner workings of the body.
Hmm.
So
You would think they
the
would,
one,
you know?
but
Okay.
I
Mhm.
was trained under something called the fourth edition task list
Okay.
for applied behavior analysis. And one specific line stuck out to me.
Mhm.
It was G02. It said, rule out underlying medical issues as causes of behavior. And I thought to myself, when I went through classes
Mhm.
at Pitt here in Pittsburgh, and when I went through my classes, there was very little conversation about how to rule out medical issues,
Mhm.
other than doing some assessments, asking some surface level questions, like if they have allergies or eczema and things like that, and then referring them to their pediatrician.
Mhm.
And so it became very problematic for me when I understood that pediatricians generally, not all the time, generally only have about 7 to 10 hours of nutrition training.
Right. Right.
They don't understand because they haven't specialized in
Yeah.
developmental pediatrics. They don't understand about gut health and nutrition and all these things. And so that's what was the catalyst for me to get my doctorate in the biopsychosocial approach to
Okay.
applied behavior analysis. That's what my dissertation focused on. And so that really was a catalyst for me in understanding what else is going on here and how else can I help Preston. So that really made me pursue trainings in certified. I became a certified infant massage instructor, certified integrated mental health provider, and
Okay.
understanding nutrition
Mhm.
and working as a vision therapist for a while to
Right.
understand binocular vision dysfunction because that's a problem in kids with autism and ADHD. related to trauma.
Right.
And so now he's doing really, really well. But I had to work a lot with him to do sign language and the reflex integration therapy and the occupational therapy and all these different things. So he's doing really great.
Uh, and I'm happy for that, and I love to hear that. And you had a lot to do with that, and still do. And think about the mother or father who don't have any healthcare training or any kind of clinical training like you had. Imagine how lost you would feel. It's a benefit that you had some people in your life where you were already working on this kind of stuff, and you had the signs are pointing to, oh my God, this is coming together. I know about this. Let me dig deeper. But for the most part, most people don't have those connections or that kind of training to even know that about anything about that binocular thing you talked about, you
Right.
know? And so how do we get the information and the wisdom and knowledge that's in your brain? How do we get that to those families who know nothing and they're just taught the Western medicine approach when they're having their first kid, and all they're focusing on is the A plus B plus C D, and then God forbid something happens, then it's like, oh wait, now what? I don't have a path B. How do we get this information, Adam?
So when I work with clients privately, the first step is about an hour and a half to 2 hour conversation.
Hmm.
And that's really the deepest part of my therapy is helping families understand the root cause.
Hmm.
So that is asking about birth experience and nutrition, constipation, diarrhea, eczema, ear infections, reflux, if they snore when they sleep. So we're going through a lot of signs of binocular vision dysfunction, like do they side eye the television, or do they
Mm.
look down, or do they look up? Are they preferring to stand or sit, or are they doing a lot of self-stimulatory behavior like rocking or flapping?
Hmm.
So through that private work, then we work together for generally 3 or 6 months every other week for an hour.
Okay.
And so through that process, I'm not only helping them understand what is something that you can do right after we hang up that
Mm.
might be able to help your son or daughter.
Love that.
What can you do in the next week? And then what can you do in the coming weeks and months?
Hmm.
Because I'm looking for connecting them specifically because we start at gut health, just some vitamins and probiotics, but not all vitamins and probiotics are created equal.
Right. Absolutely.
That. And then we work on the diet, and then we work on connecting them with people that are local to them that can work on primitive reflexes and the
Hmm.
trauma, detox protocols, but just some of the things that even if families, I offer a 30-minute complimentary conversation,
Hmm. Yeah.
just talk about some general things. And so there's a lot of value even in that complimentary
Absolutely.
conversation.
Well, I think, the more that these conversations you and I are having become norm in society, that's really how we can get this information out there. And, I mean, social media has its drawbacks, but it also has its benefits. That the reason you and I reconnected, because you and I met like 3 or 4 years ago. We reconnected because on LinkedIn you posted something that opened my eyes, and you talked about, and we kind of dabbled in it right now, but usually what happens when you see your child do something different from all the other kids, we go right to going to somebody about behavioral issues. Why is he not behaving? Now, my son is 23 and he's got autism, and I remember he used to run back and forth, corner to corner in the room, and we just thought he had a lot of energy.
Yeah.
We didn't do anything about any of that because we didn't know any different 23 years ago. When he got older and was able to articulate, I asked him, "Do you know why you did?" He goes, "Yeah, I thought better. I could think better when I was moving." And he's like that now. He sitting still doesn't help him focus because it makes him overthink on things that he doesn't want to focus on. So that he also touched the lobe of his ear a lot, and mine and his mother's. So that sensory thing, things I would have picked up now had I known, and we ended up having him tested a little later in life. So when I mentioned social media, you posted something that really got me, and you talked about rather than jumping right to behavioral issues, How about take your kid to the ear doctor, the eye doctor, the nose doctor, the mouth doctor, the dentist, the ENT?
Mm.
Because if you have a child who's just not, old enough to be verbal and is nonverbal, or too young to speak just regular, they may be in pain and not able to let you know. Or like you said with the eye, if they're doing the side eye and you're saying, "Oh my gosh, my child doesn't look me in the eyes, there must be something." Go to those first level doctors. I call them first level because that's where we should think right away. The dentist, if there's mouth pain, the eyes, if there are vision problems, the ears, if there are hearing problems, and what did I miss? The ear, eyes, nose. So tell me about, and the nose too. So tell me about, and thank you for posting that. Tell me a little about the post and what got my attention.
Well, really, it's understanding the root cause of what's going on because behavior is very observable, it's measurable, and our society has become so connected with the fact that when we get a diagnosis or we think there's a behavioral issue, we've been conditioned as a society, I think at least here in the US, to get applied behavior analysis services.
Mm-hmm.
So this isn't to say that I'm not a big component of ABA because I use ABA in my therapy every day,
Mm-hmm.
secondary to the fact that we address the root cause.
Mm-hmm.
Because when you can address gut health, you can address nutrition, you can address unrecognized pain,
Mm-hmm.
an unmet sensory need, like when you talked about your son running back and forth.
Mm-hmm.
When kids are, because I always ask parents, that's one of the questions in my assessment, is your child always on the go?
Mm-hmm.
Right? Are they toe walking? Are they rocking? Are they flapping? And usually that's a sign that the body's in fight or flight.
Mm-hmm.
And you can do some very simple things like add a vitamin, add a probiotic. It's like people, and in perspective, it's like whenever you plant a flower,
Mm-hmm.
it needs certain things to grow. And if the leaves on the flower start to turn brown, you don't cut the leaf off, right? You might in society, but you really have to look at the roots. What's
Right.
going on with the
Mhm.
soil beneath that we can't
Right.
see? What's
Right.
going on inside of that child that we can't see?
Hmm.
That's why that developmental pediatricians, developmental optometrists, we have a great one here in Pittsburgh. His name is Dr. Hans Lessman. He's in Smithvale. And those specialists really help understand the root cause of what's going on. And that is so imperative because once you can do that, you can understand it's not that your child won't behave, they can't.
They can't. So you really hit on something very important because there are many more behavioral pediatricians. I just throw the word behavioral in front of it because most
Yeah,
pediatricians
the
don't have
behavioral
that.
developmental pediatrician.
Yeah,
Yeah.
they don't, but a lot of them don't have that developmental background, like you mentioned, 7 hours. So if we can increase the quantity of developmental pediatricians and then the developmental and behavioral pediatricians consult together on the same case with the same patient. Ideally, there'd be pediatric practices that have both developmental and behavioral pediatricians because they can sit and consult and do case studies and share information. Aside from that, if those pediatric departments don't have that diversity, then we definitely need to have more people on the outside know this stuff, whether they're lay people or not. So,
There's definitely a lack of collaboration between those two worlds
yeah,
because it's also Eastern versus Western medicine
mm-hmm,
views.
mm-hmm, mm-hmm,
And when your world is built around, and mine was too, around ABA, right? It's still
yeah,
partially is.
yeah,
Whenever you are so passionate about a topic and helping people in one particular arena,
mm-hmm,
I would encourage people, if you're in the doctoral field in any way, shape, or form, not to get too hyper focused on them and not to prevent your patients from making informed decisions,
mm-hmm,
right?
mm-hmm,
I love it when my parents work with a pediatrician and they listen to them,
yeah,
actually have bedside manner,
mm-hmm,
and let the parents trust their gut instincts and say,
mm-hmm,
I don't know much about that, but I'll explore it with you.
mm-hmm, mm-hmm,
Let's
absolutely.
understand that together. Let's how to help your son, right? If that child is coming to you time and time again and they're having the same issue over and over again, have you really done what your purpose is in life?
Yeah, I know. I love that because we do seem to try to tackle symptoms because it's easier. That's the
Hmm.
easy way is to handle symptoms. The root cause, obvious. I mean, to me, it's like common sense and obvious. But I've been in healthcare for so long. I was always into like, well, why? Always questioning why is this happening? Don't put a band-aid on a hemorrhage. Let's find out why the hemorrhage is happening. So, and that's the issue, like with a lot of our chronic diseases in this country, because they're chronic because we keep addressing the symptom and not the root cause of it. So, if nothing else, I want the audience to take that root causes are more important than symptoms. Symptoms you could see, they're telling a story. The symptoms are
Right.
tapping you on the shoulder and saying, hey, there's more to this.
Yeah. Yeah. It's just like whenever the indicator lights come on your dashboard in your
Good
car.
point. That's a good one.
Mm.
Yes. Why is the check engine light on?
It's like, why is the belt making that weird sound?
Yeah, because imagine if the check engine light comes on and you go to a friend and say, "Do you know how to turn this check engine light off? It's bothering me." That's like symptom rather than, well, there might be a reason why that check engine light's on. Let's dig deeper and find out why. Um,
It's getting connected with the right mechanic.
Oh, there you go. Yeah, let's just that. It's true. It's true. There's so many parallels to that, to
Yeah.
taking care of a car versus taking care of a human. We seem to take care of our cars better than we take care of our humans. Um, that's another story. So, Kristen, anything else? Is there anything else that I may have missed or we haven't talked about that you would like the audience to know?
I would say if you're a parent listening to this, always trust your instincts. Get a second opinion and find a provider that is going to listen to you at the bare minimum. Find a provider that is going to value your input and help you explore alternatives. That's so valuable.
Mhm. Absolutely. And I think and I love that. Thank you for that message. And the sooner the better. I mean, I think if you surround yourself with the best practitioners who will listen to you, when you see something in your child and first instinct is, I want to talk to somebody about this, don't overthink it and think yourself out of bringing them to somebody. But the first thing is, like I said, have that community you can trust, and
Mhm.
then then you listen to your instincts and bring it up. But don't don't not do something about it.
Right.
I think, well, the audience certainly has captured the essence of Kristan Weisdack, and they're going to want to get in touch with you. So, audience, please, if you're out there and you have any type of questions or wondering about your child, a conversation with Kristen is well worth it. Uh, Her email address is emailing Kristen is probably the best way to get in touch with her. So it's behavior behavior works WORX PA for Pennsylvania. So behaviorworxpa at gmail.com. Email Kristen and she'll get back to you. Um, all right. So I have two questions for you, two final questions. All right. So picture yourself in your happy place, where you like to be, and you're sitting down with young 7 to 10-year-old Kristen, and you want to give her advice about life. What are you going to
Mhm.
tell her?
I would say trust your instincts. That would be the biggest thing.
Mhm.
Trust your instincts and don't let anybody dull your sparkle. Do things in life that make you happy. Be with people that fulfill you and make you feel loved and appreciated.
I love that. That's wonderful. All right, switch hats. You're now sitting down with young Kristen, the young businesswoman entrepreneur, and you want to give her advice about business. What would you tell her?
I would say the same thing. Trust your instincts. And if something doesn't resonate with you, because I think when we're not happy, we don't connect with energetically who we are,
Mhm.
because we're all energetic beings as humans, right? We're just made up of massive cells
Mhm.
that vibrate at a certain frequency. And surround yourself with people that will build you up and not break you down. Find your community of people that truly appreciate you and value you and are going to help you and that you're going to help them, right? You have to have that reciprocity. I do a lot of work um, in the holistic space, obviously, but I've also worked in the blue zone treatment.
What's that?
Blue zones are where, and this is a whole nother day for
We'll have part two of
time.
this.
Yeah. But blue zones are areas of the world where people live to be centenarians, so 100 or more.
Oh, okay.
Very high statistics that they reach that age. And one of the phenomenon that the Japanese follow is called ikigai.
Hmm.
So ikigai is being with people that build you up, that
Hmm.
fulfill your purpose.
Hmm.
Because when we're connected with that, we are like batteries.
Okay.
We need charged.
Mm.
And when we are with people that drain us,
Mm.
it's no good, right? We can't be our best selves.
No.
So be with people that energize you, that make you happy, and that fulfill you, and also that you can lend something to them to a value.
So that's beautiful advice, and that advice can go to anybody who's listening because, yeah, I've been on the side of allowing somebody to drain me, and that's the thing. I allowed it.
Hmm.
We can control it. We have control over who we allow in our space,
Hmm.
right? No one can force. We can make decisions every day,
Right.
and we're looking to make the best decisions for ourselves. So, Kristen, thank you so much for coming on, but more importantly, thanks for coming into my life. Um, I've got a lot going on moving forward with the special needs space, and you certainly are going to be one of my go-to people because the world needs you. So keep doing what you're doing. Thank you.
Well, I look forward to the opportunity to help more people and to help you on your journey as well. So,
Wonderful. Thanks so much, Kristen. Hey, everybody out there, please take care of yourselves. Thanks so much for listening. If you enjoyed the episode, please subscribe and give us a review to help others find it. I'd like you to answer this question. Are you living the life you want to live, or are you living the life others want you to live? I'd like you to think about that for a second, because I strongly suggest you live the life you want to live. If you want to learn more about what I stand for and my services and how I'm able to help many men get out of their own way, please go to my website at www.profitcompassion.com. Feel free to also email me at drew@profitcompassion.com. I'd love to have a conversation with you. Take care of yourself and choose to write your own story instead of letting others write it for you.